Thank you so much for joining us. I'm Helen Jung with the Oregonian Editorial Board, and we're here talking with representatives from both the Yes on 110 campaign and the No on 110. I think what we're going to do is just start off by having the Yes side give us a quick overview of why they think voters should vote for this measure, and then we'll turn it on over to the No side. But let's start with you want to start?
Great. Hi, I'm Andy Seaman. I'm an addiction medicine specialist and researcher and former jail physician. I'm the only addiction doc on this panel, but every other member of the OHSU addiction medicine faculty supports this measure, as do almost every addiction specialist and treatment organization in the state that practices evidence-based treatment and don't have a financial interest in maintaining the status quo that is just not working. I have cared for people at every step of this current system. Imagine you have an opioid addiction. You're trying to hold down a job, maintain housing and relationships, not to mention your mental health and self-worth. You get picked up for possession and wind up in a cold jail cell or forced to go through withdrawal, even if you're on treatment often and your mental health is destabilized. Now you may have lost your housing, your job, and now you have a criminal record. You're kicked out to the street, often without any linkage to care, and you are 120 times the risk of overdosing in those first 2 weeks in the community, all because we decided to arrest people for their medical illness. Now imagine 110 passes. The same person encounters the same police officer and they're given a hotline. They talk to a kind person with experience treating addiction, help them navigate through treatment, and access the $60 to $100 million new dollars for treatment of addiction in Oregon. They have a chance. Or imagine you're a middle-class worker with addiction or a family desperate for help. You can access these resources too. I also want to just call out that if you are a Black or Indigenous person of color navigating that same system, the data shows that you are worse off in every one of those steps, less likely to access treatment, more likely to get arrested, more likely to have complications. And this is because addiction is an equal opportunity offender, but the system is not. And this directly addresses that. You're going to hear from people that this measure will rob people of their recovery through court-mandated treatment. There will always be anecdotes, but the evidence suggests that compulsory treatment does not work. And if you answer that it does in an addiction board exam, you will not get that answer right. And that's because addiction is a complex brain disease, not a moral failing. So I just want to say that this recognizes addiction as a public health problem and deserves a public health response. Measure 110 provides millions of new dollars for evidence-based treatment across the state and not just wealthy urban areas. And it addresses systemic racism in the criminal justice system more than any legislation or measure in Oregon in my lifetime. I urge the Oregonian to endorse this measure.
Hello, my name is Jessica Camphy, and I'm the Executive Director of the Public Defender of Marion County. I've been a practicing criminal defense attorney for 14 years. Since becoming the Executive Director of the Public Defender's Office, I've had the opportunity to work on reforming criminal justice policy. To that end, I serve as a commissioner on the Criminal Justice Commission, a member of the Prison Forecast Advisory Committee, a member of Marion County's Local Public Safety Coordinating Committee. Additionally, I'm the board chair of Shelley's House, which provides clean and sober transitional housing to women. The intersection of criminal justice and addiction is near and dear to my heart. For too long, I've seen how our current system harms people living with addiction. Currently, when a person's arrested for drug possession, they're either given a ticket to come to court or taken to jail. Jail is not a therapeutic environment. No other health problem is treated this way. The criminalization of addiction is even more abhorrent when we look at the CJC data that shows that Black Oregonians are substantially overrepresented in PCS arrests compared with white Oregonians. The war on drugs is racist, and the criminal justice system gives people arrests and convictions, but not treatment. Presently, a person charged with simple possession will be arrested and about 5 weeks later appointed a lawyer. Another 5 weeks later, a first opportunity to resolve their case. If they plead guilty at that time, they're then convicted of a crime and ordered by the court to pay out of pocket for an evaluation within the next 30 days. After paying for the evaluation, the individual has to fund their own treatment, either through health insurance or pay out of pocket. If they fail to comply, they go back to jail. Jail is dangerous for addicts, in part because they're regularly released to the street without support and at an increased risk of overdose. The system creates so many barriers to success. From arrest to the first meeting with treatment provider takes a minimum of 3 months. During that 3 months, the person's active in their addiction and getting no help. The arrest and conviction are on the person's record and lead to collateral consequences, including difficulty finding employment, loss of access to student loans, difficulty finding housing. Additionally, being in jail can—
Thank you. We'll get into that some more, but I do want to move over because you're past your time, and we have some strict time limits today.
Thank you.
Does the No campaign want to start?
Yeah, we do. Thank you so much. My name is Tony Vesna. I'm a person in long-term recovery. I've been in recovery over 8 years. Throughout my recovery, I've been the student body president of Portland Community College. I've co-founded nonprofits that dedicate themselves to helping people get into recovery. I've helped hundreds of people get into recovery. I co-founded Oregon Recovers. And in general, you know, I would say that from my vantage point, Measure 110 is bad policy pushed by worse politics, but supported by good people. And if passed, it will do too little, too fast, and people will be harmed. Now, if you look at evidence-based practices for decriminalization, and you look at Portugal, what Portugal did is it invested significantly into prevention, treatment, intervention, and recovery support 2 years before it did decriminalization. In addition, what Portugal did was create a similar kind of community court where people were referred there and they met with somebody who had a legal background and 2 social workers. And these people could impose sanctions on an individual, or the person could go to treatment, and the person would elect to go to treatment. What Measure 110 does is it doesn't bring very much money in the system. It takes money away from education, currently funded treatment programs, and prevention efforts. And in Oregon, we suck at prevention. We spend less than 1% of all substance misuse dollars on prevention. And this measure doesn't invest anything into prevention. So, you know, moving forward, I would just like to say that this measure is harmful in the long run because it's going to disrupt a system which is getting people into treatment. And treatment organizations aren't even endorsing this measure. And that's why the Oregon Council on Behavioral Health rescinded their initial no position and moved to our initial neutral position and moved to a no position. I'd like to pass it off to C. Autumn to stay within my time.
Oh, is that our time?
No.
That's just my time. That's my time.
Oh, okay. Apologies. Thanks again. My name is C. Autumn Edmo. I'm Shoshone Bannock Nez Person Yakima, and I'm the co-chair of Oregon Recovers. I am a person who is a part of the recovery community. I have several family members who have struggled with addiction and have been involved and engaged in working with tribes and tribal communities on addiction and recovery issues for quite some time. And I guess for me, what this comes down to, because I think I speak for many people on this call, in that Oregon Recovers as an organization agrees wholeheartedly with many of the points and motivations of folks who support this measure. However, and again, like reiterating what Dr. Seaman said, like, it is vitally important that we treat addiction as a public health issue and not a criminal justice issue. However, that being said, to Tony's point, how we do it is also very important. Had I had $2 million to invest in Oregon to come up with a solution at the intersection of the court system and treatment and recovery, I would have chosen to invest my money very differently. 90% wouldn't have gone to white political consultants. It would have gone to having conversations with tribes, with providers of color, with folks like NARA Northwest, Red Lodge Transitional Services, Miracles, many of whom haven't even been engaged on this measure, to find the solutions that work for communities of color and center them into what we do. It's very telling to me that that the how of the campaign, right? Many of the organizations who are embedded in communities of color have not come onto this campaign until very late, until after the measure has already been submitted and approved, and the language has been submitted and approved. And we're actually not at the center of creating what it would be envisioned to look like. Oregon has actually a plan, and proponents of this, a strategic plan developed through the Alcohol and Drug Policy Commission, and folks who worked on this measure actually declined to, so we have an answer and a pathway, and the folks who were involved with the campaign chose not to engage in coming up with an Oregon solution.
So let me ask you, what would be, I mean, what is the measure missing that you think needs, the specifics that you think are missing?
I think one, real revenue. And I can let Tony talk a little bit about that.
Yeah, so one of the issues with the current measure is the way that it creates funding. So the measure kind of purports that it's going to create enough treatment and resources for everybody in Oregon, but it's not going to. From our calculations, and you can look this up for yourself on the analysis the Secretary of State did, it would bring in about $68.4 million in new revenue. So part of the revenue that it's getting from the marijuana money is taken away from currently funded treatment programs at the county level. And it's taking money out of prevention. So it takes money out of currently funded treatment programs, prevention, and then education. So we need new revenue. We don't want to, rob from Peter to pay Paul or whatever. Now, if you look at some of the largest organizations, treatment organizations in the tri-counties, you look at their 990s, and you can see that like Central City Concern spent about 80 million, I think, in 2017 on expenses. And this revenue only brings in $68.4 million in new revenue. And I don't understand how that's going to transform the treatment that we need. There's no analysis for how much money we need. I don't understand how that's enough to meet all the need across Oregon. And it only focuses on one part of the system, and it doesn't invest in prevention.
Tony, I must interject at this point because you brought up Central City Concern.
Right.
I'm Ed Blackburn. I was the CEO of Central City Concern for about 10 years, but I worked there a total of 27 years. And I certainly know a lot of the organizations that Tony's been involved in. I'm glad to see him here. But the budget for Central City Concern includes things like medical care for thousands of people. It includes expenses for housing, for property maintenance, for housing staff. The total budget of Central City Concern of $80-some million is not all going to alcohol and drug treatment. And in fact, it's a significant, but it's not the major share of funding by any means.
Right, and Ed, I didn't mean any disrespect, and I appreciate you and everything that Central City Concern's done. I don't think it's very much revenue. And if you look at some of the other big treatment centers like CODA, for example, it's about 20 million. And so this would only triple CODA's budget. And so I just worry that it's not enough to meet the need.
I'd like to interject there too, just on the treatment side, because I think that's also not a comparison that maybe makes a lot of sense. CODA is funded through insurance and will continue to be funded through insurance. And I think what this funding does, we're not saying that we're going to take $60 million and that's going to be it's not just 60 to 100 million, and we expect that number to grow, that'll be all of the funding for treatment that the state needs. I don't think anyone is really trying to say that. And if they were, that's not really quite honest. I would agree with that. What I would say is that this is one of those things, one of the things you often find is that you're trying to do a treatment intervention and you can get like 90% there with funds through clinical resources, through health insurance, if you have Medicaid, et cetera. If you don't have Medicaid, that's a whole other story. But what you can do with these funds, you can use creative grants to make something from not feasible to feasible with a very small proportion of the overall funding. That's one of the things that this funding does. Another thing that it does is it allows funding for things that we cannot do through existing funding streams. You can't provide access to harm reduction resources that saves lives. I'm probably the lead expert in hepatitis C in the state for treating people with hep C with substance use disorders. We can't do harm reduction all over rural Oregon because there's just no access. You can't use federal funding for that. This allows us to do what the evidence shows us, not what the politics wants us to do, including, as you mentioned, prevention. There's nothing in this bill that says you can't use these funds for prevention.
Can I just ask you to clarify a couple of those things?
Sure.
So is there anything in the bill that says X amount of money has to go to prevention? Anything in the bill that says X amount of money needs to go to treatment or X amount of money needs to go to this thing. And in those allocations, is there any sort of methodology that's been done, scientific methodology, like through an infrastructure analysis?
Well, what I'll say is that a lot of this will be guided by the experts on the panel, which are all going to be people. You could be one of those people if you want to be part of this. This is a community volunteer-based project with including an addiction researcher, an addiction specialist, and many other people with lived experience. As far as the specific breakdown, I'm going to defer that to the campaign to answer.
Yeah, and I just want to mention that Anthony Johnson, one of the chief petitioners, former criminal defense attorney, and the measure doesn't make promises that this solves the issue. This changes our culture, reduces stigma, raises the priority of this issue with legislators, voters, policymakers, and the goals of even the opposition that wants to invoke the ADPC strategic plan, wants to pass an alcohol tax. Measure 110 does not prevent any of that. But what Measure 110 does do is prevent the arrest and jailing of 4,000 to 8,000 Oregonians plus every year for simple possession of drugs, disproportionately Black, Indigenous, and people of color. And the funding sources are left to the Oversight and Accountability Council, who are comprised of experts on this measure. So even if you took the opposition's numbers of almost 70 million, if you look at the state's numbers, it's closer to about 100 million. If you look at other savings from law enforcement that Eco Northwest put together, this could bring in upwards of $120 million per year. So whether it's 70 million, whether it's 120 million, it's more money for treatment, research, prevention, harm reduction, housing services, job placement, things that people need to tackle their addiction. So I think any way you slice it, it's a step in the right direction. And we're not saying it solves everything, but it definitely helps reduce stigma, reduce arrest, and provide more funding for treatment recovery services.
Helen, you asked what's missing in the measure, and I do want to also give my answer to that question. For me, it's missing, while it may be a step in the right direction, I do think it's going to be 3 steps back. I think it will set us 3 steps back because first, it doesn't address past harm. So, right, so anybody who has been incarcerated now moving forward, none of the harm that has impacted their families, there's nothing in there for them. Second, for me, it's missing an authentic centering of BIPOC communities. And that means specifically, I want to talk about tribal people and the way that the campaign has actually not organized with tribes. I don't know, to my knowledge, they have not gone to the Oregon Indian Council on Addiction, who meets quarterly. NARA Northwest, our biggest provider of tribal treatment in the region, I just talked with Jackie earlier this week, and the campaign has essentially not been in conversation with them. So if it is indeed purporting to center BIPOC, and especially I'm talking about Indigenous communities, having not communicated with them until 30 days out from the election is really misrepresenting how it's moved forward. And also, I mean, we are seeing, just in having initial conversations, like Oregon Recovers, and I personally did not want this to be the case. I didn't want to debate whatever this side of the issue, but we had tried to engage with the campaign and tried to say, look, we have this strategic plan that we're developing. Come join our strategic planning process. Come join what is going to be Oregon's, hopefully, answer to the addiction crisis that is supported by the governor, that Dr. Richardson had developed with the Alcohol and Drug Policy Commission, that Tana Sanchez in the legislature has championed. And their answer was no, we're going to do our thing, funded by the Drug Policy Alliance, and completely ignored a lot of the leaders who had been working in this space. So that's what's missing. That's what's missing for me.
Man, if I could, if I can respond to that, the campaign has talked about this measure with many, many stakeholders across the state and got input in many, many realms, and people working in criminal justice, people working in treatment, people working in recovery. It does have the endorsement of the Confederated Tribes of Grand Ronde, has the endorsement of the Native American Youth Family Center, Coalition of Communities of Color, 30 BIPOC organizations. I will say we've reached out to NIA, NARA. We've reached out to organizations all across the state. And I think you see an unprecedented number of BIPOC organizations, along with organizations that normally don't take an issue, take a stance on an issue like this, like the Oregon Food Bank and Planned Parenthood. And so the wide swath of people that have endorsed this measure from NAACP of Portland, Eugene, Springfield. I mean, at the core, this issue is a racial justice issue. We've arrested too many people.
Anthony, is it true that NIA pulled its endorsement? Is that your understanding?
I am unaware of that, to be perfectly honest with you. That endorsement has been pulled.
I'll forward you. I can forward you the email.
That's fine. And I would say that we put in a lot of work in the Coalition of Communities of Color, and to like diminish the communities of color, the Latino Health Coalition, PCOON, their support of this measure, I think is unfair. And when you see indigenous populations, Black populations who have been disproportionately arrested, convicted, who the collateral consequences disproportionately hurt people of color, access to jobs, education, and the past harms of this measure the past harms of our current drug policies to expunge past records, those are things we want to work on. Just after Oregon legalized cannabis in 2014, expungement was passed later, and we are going to continue working on those issues. And to say that we don't address past harms, you don't correct past harms for arresting 8,000 more people every single year. And so we have worked really hard to get communities of color, to get organizations all over the state to endorse. And I think to say that 90% of the funds went to white consultants isn't fair either, when most of the money went to get this measure on the ballot, which is very expensive during a coronavirus pandemic. And the biggest recipient of the money is Unite Oregon, which is in a partner with this measure that we have helped build their capacity to reach out more to more of their constituency who suffered under our current drug policies all across the state.
So I would like to know about the fact that it is kind of taking anything above, is it $45 million per quarter? Or I'm sorry, $45 million annually. Anything above that would go to addiction services. Is that correct?
That's correct.
Okay. So what about the argument that that's taking away from programs that are already relying on that money?
Mm-hmm. So when Oregon voters voted to pass marijuana legalization in 2014, the state expected we'd bring in $40 million a year. And now we bring in triple that from marijuana tax revenue. And so that excess cannabis revenue above $45 million, in addition to savings from law enforcement from not jailing and prosecuting and arresting 8,000 Oregonians every year, will go into funding more treatment and recovery programs. The school budget, which, this amount of money is very minuscule in the $9 billion a year school budget, but the school budget has been kept whole. That $9 billion budget is going to remain intact. The 35% of the revenue that was earmarked for Oregon State Police, city and county law enforcement, they're no longer arresting as many people for marijuana offenses. They'll be arresting fewer people for drug possession offenses. We think Oregonians will agree and do agree that our reallocation of these resources is a better use of that money. And then the money that goes to current drug treatment and prevention programs, we're going to expand the amount of money that the state spends on drug treatment and recovery by about fourfold, if not more. And then we're going to put in place an oversight and accountability council that's comprised of addiction doctors, researchers, people in recovery mentors themselves, people from communities who have disproportionately been harmed by our current drug policies. And we're going to have an audit every 2 years and a public report. So voters, policymakers, legislators are going to see where the money's going, benchmarks for success, and we can adapt over time to make sure the revenue is being used in the best way possible.
Can I just ask you a clarifying question, Anthony? So people on the yes side have been saying that this is going to quadruple the amount of treatment money that Oregon spends every year. Can you explain that?
Yeah, you can look at the Criminal Justice Commission has done this report, and we're happy to share this information on the editorial board. Oregon spends about $25 million a year on non-Medicaid funding for treatment and recovery. And so this measure is going to bring in about $100 million, if not more, from savings from law enforcement and excess marijuana taxes. So we are going to increase funding, even by your numbers, it's 70 million, nearly 70 million more. So any way you slice it, it's more money for treatment and recovery programs, and puts it in the hands of people who know the issue the best. The money must go to every area of the state, and we're going to have have benchmarks for success and a public report. Transparency we don't have now. And so I think it's a better policy for Oregon. And from what we've seen, Oregonians agree.
So how much of it tracks with the Oregon Drug and Alcohol Policy Commission with the work that they've been doing? In terms of what you guys are looking to do, I mean, how closely aligned is it with the commission's work?
I mean, I think it increases funding. I think the ADPC and others want to pass an alcohol tax, so we do increase funding. And the ADPC and the state has proposed redirecting marijuana revenue to go to more treatment and recovery programs. So in those realms, it matches it. You know, I think the one concern about the ADPC and proponents of Measure 110 has been the lack of reducing criminal penalties for the offenses. You know, the ADPC includes members of law enforcement who definitely have not gone along with wanting to reduce the criminal penalties of civil infractions. And so to move from a health-based approach, we wanted to go a different route. Now, that said, the desires of Tony and Siadam and other people who want to implement the ADPC strategic plan, Measure 110 does not prohibit that. That's the beauty of a legislative initiative. Every initiative that gets passed gets sent to the legislature. They can change things, and we're going to have a public report every 2 years. So the goals of the ADPC are not infringed upon. They can still be implemented. But for us, the current system has failed so badly. There's no reason to arrest and jail and prosecute thousands of people and not give them any treatment. And we want to raise this priority with law enforcement. And you know, the process and the ADPC and what people desire is not on the ballot. What's on the ballot is Measure 110, reducing criminal penalties and prosecutions, increasing funding, even from the opposition's standpoint, or the failed status quo. And to think we can wait while there are people who don't get the treatment they need and 1 to 2 Oregonians are dying every day, we think that's a mistake. And we think Oregonians need to pass this measure as soon as possible to stop the harms that are being caused by the current failed system.
I also just wanted to,
all of us here can agree that we all know that drugs is one of the biggest reasons that people are being arrested. Black and indigenous people are mostly targeted. We've been doing this for years. We all know this. So if this is helping to stop that, and you guys don't want to help stop that, you know what people who are addicted to drugs, man, how something like that can affect them, man. You realize that spins you to a down spiral, and you might not ever come back from that. You don't have time to wait. Why we gotta wait? How come you guys can't join us? It's here for you. You see it. What you do, you will benefit from this.
Yeah, I did want to ask Tony. I wasn't quite clear from what you were saying initially. Do you object to lowering the classifications of small or possession of small amounts of drugs?
No, I don't. You know, after analyzing the Portugal model, and you know, I'm an addict. I work with addicts every day. My entire family's addicts. I'm watching people in my family use right now. The Portugal model, it imposes this new intervention system, right? So addiction, you know, boil it down. The addiction doctor, he could tell you all about it, but I'll just boil it down real simple. It just hijacks your brain, so you have a hard time making decisions that are in your best interest, and a lot of the time the decisions you make harm yourself and the people closest to you. So the intervention that worked on me, you know, several times was the criminal justice system when I couldn't stop. You know, I couldn't stop myself, you know, and stuff. And so, you know, I just I'm not opposed to doing that, but I think what we wanted to do and why we tried to partner with the DPA in the beginning when they brought this and say, hey, no, look, we're building up prevention, we're building up intervention. We want to talk about public health. Can you go to a hospital right now and get immediate detox? You know, I was in the hospital at OHSU for 3 weeks with my autistic daughter, who was having like massive behavior. She's 11 years old. And there was cops in OHSU who were pinning her down, injecting her with antipsychotics. So there's cops and criminal justice stuff embedded in public health. So it's like everybody has to beef up their competency around a lot of things, you know? But anyway, so it's like, hey, we want to invest all of this new revenue. Let's not take away from schools. Let's not take away from prevention. Let's go after alcohol. We have the lowest alcohol tax in the nation. And let's do this strategic plan that brings everybody around the table. Criminal justice, public health. Let's build this system up, get everything in place, and then we can start working on that. I don't think this measure goes far enough. I think, okay, we want to hold police accountable. I think we look at Joanne Hartstein in the measure she's got going on in Portland that's going to create an independent community oversight council that's going to be able to do investigations on messed up police. I think that's a great measure. This, now it's like a cop goes from arresting somebody, right, for having possession to giving them a ticket. But if the cop is a messed up person, it doesn't change that, you know what I mean? And then it doesn't provide the significant intervention that some people need using.
I want to talk about what Tony just brought up was a scenario that if you get rid of the sanctions first and then the treatment doesn't come till later, that's a problem. I just want to point out that Central City Concern was founded at the time that the state of Oregon decriminalized public intoxication. Up until that point, that if you were intoxicated in public, you would be criminally charged and taken to jail. In Portland, for many, many years, that has not occurred. And we still don't have the system that we need just for alcohol addiction treatment. But no one would propose we reinstitute that old method of taking people to jail for simply being intoxicated in public. That does not help the situation. I've been doing this for almost 30 years, involved in this business. What treatment providers think are important to me, but they're not the ones that get to decide the greatest policy in terms of how it affects Oregon. Hundreds of thousands of people signed this ballot measure, and it's going to go to a vote. That is much more important because this problem of addiction affects many more people who are not currently working for alcohol and drug treatment programs or prevention programs. This affects a bigger community, and what those organizations think is just as important what treatment providers think. And that's coming from a treatment person who did involved in treatment, providing treatment for over 25 years. But what we really need here is, Tony mentioned the budget of Central City Concern. This measure is going to reduce those penalties for about 8 to 10,000 people a year. Central City Concern treats about 15,000 people a year. So when we look at that juxtaposition, then that amount of money could do a lot of good in terms of opening up treatment opportunities, particularly with the flexible funding that will be involved with this measure. We can pay for things like recovery housing, for recovery mentors, for employment services, all those things that are important for recovery beyond treatment. It will pay for treatment if Medicaid doesn't pay for it. There is nothing in this that is contradictory to the state plan. In fact, it will help move it forward by giving it some actual resources. It empowers an oversight committee, just like Tony, you mentioned, with police accountability, but they will actually have financial resources. That gives them more power to make change in the state, and I hope you're part of it. I hope you're part of it. But here's what we need for someone in Coos Bay. This is what we need, and I got these calls, many of these types of calls. I need help now. I don't know what to do. I don't know what to do. This allows us to get a person on the phone with them, make that person available, where they can say, meet me in a few hours. I will talk to you about how we can change your life, what is going to be available to you, and we can start that process now. We need that now. And for those parents that have called me, many, dozens and dozens of parents over the years, what can I do for my daughter? I have to kick her out of the house. I can't have her here anymore. What can we do? Now we would have an answer. This is what you can start right now. And that's not real expensive.
So one thing I wanted to ask was this says anything above 45 million or whatever that exact number is a year. Presumably, marijuana sales tax revenue will continue to go up, at least to a certain extent. And even if it doesn't, it's still a sizable amount of money that is not available for other state purposes. So why is it that there should be this, in perpetuity, this dedication of any funds over X amount of money?
Well, I'll say that's one of the beauties of the initiative process, and that these funds can be redirected. When people draft a measure, you don't know that there's going to be a coronavirus. You don't know certain situations are going to occur. So with the audit and the report and experts in charge of the funding, every 2 years, we're going to have a say of where these money spend. And Oregon could, the federal government could legalize cannabis, and Oregon could bring in a lot more revenue all of a sudden. And that money can go to other sources. It can go to prevention. It can go to the things that our opposition wants to spend money on, and it'll go to good sources in treatment and recovery, harm reduction, housing services. And so, yeah, it can be adopted. It can be adapted over time. We think there's funding that needs to be done. I think the opposition wants to pass an alcohol tax and wants more revenue. And so I think everybody deems that Measure 110 is not the end all be all. It's a step in the right direction. It brings in more funding, and that the legislature, policymakers can address it over time. And I did want to clarify that NIA is neutral on the measure, but they are a member of the Coalition of Communities of Color, and the Coalition of Communities of Color have endorsed. And if anybody wanted to oppose the measure that was part of that coalition, we would not have their endorsement. But I want to say that we did and have done a lot of outreach to organizations all over the state, including communities of color. But back to the point, the Oversight and Accountability Council will be able to provide recommendations. We're gonna have an audit, and the money can be best utilized on prevention, treatment, and recovery services, and be adapted over time, depending on how the money comes in and the needs of the state.
Helen, Jim O'Rourke, and I've been a criminal defense lawyer for 42 years. I've been in recovery for 35 years. I've been, the focus of my law practice for 35 years has been representing people with addictions, including alcoholism. I am the father of 2 children who suffer from addiction. I want to say that first, as a parent, what is striking to me is that we're 40-some minutes into this conversation, and there's not been one word said by anybody about how this will affect juveniles. When you decriminalize any drug or any crime for adults, you also decriminalize that for children. So for children now, if this passes, the maximum penalty for possessing up to 1.99 grams of meth would be a $100 fine or a health assessment, not an addiction assessment, but a health assessment. So that's going to put a lot of children outside of the range of juvenile court interventions and juvenile court programs. They're going to be outside the range of those programs as a practical matter, because most kids aren't going to possess up to just a little less than 2 grams of meth. The other reason is because kids are smart, and if they want to keep using, they'll know that if they they don't possess more than that amount, they'll be outside of the reach of the juvenile courts and their intervention and treatment programs. Intervention is the key word here. If you want to know what the medical profession and addiction doctors really believe about getting people into treatment and into recovery, the best place to look is at how they treat doctors who have problems with addictions and alcoholism. In fact, the model that the medical boards use for intervening on doctors and getting them into treatment and keeping them in treatment in recovery is the model for juvenile courts, and it's also the model for the drug courts and the other specialty courts that are available to adults. But I don't want to talk about adults, I want to talk about the juveniles. So the elements of the program that the doctors use on the doctors, which happens to be the most successful program that I've been told is the most successful program there is the doctors treating doctors. They use external motivation. The motivation a lot of doctors respond to is the loss of their license. They use monitoring. They monitor the person to see if they are complying with their treatment program, and they hold them accountable to do what they need to do per their treatment plan and to finish their treatment. The doctor's program monitors for people for 5 years and holds them accountable. So the juvenile courts do pretty much the same thing. They have the ability to detain, that is, use detention on a child on the same basis as an adult could be, although it's much less time that they can hold a juvenile. But in order to effect an intervention, you don't have to put a child in jail. Juvenile courts, as you may know, don't like to do that. Juvenile courts are not there to incarcerate children. They're there to help children and their families. But it's the possibility of jail which helps the child do something the child cannot do on their own, which is to stop. Most addicts want to quit, but they're afraid to, and there's other reasons they don't. I had a hard time doing it, and I needed an intervention from the Oregon State Bar. Interestingly enough, the Oregon State Bar uses the same model that the doctors use. And in 1985, 20 lawyers were intervened on. Of the 20 lawyers, all of us that are still alive are still sober. That's a pretty good result. But back to the children, this measure decriminalizes these drugs: heroin, cocaine, meth, oxycodone. These are killer drugs. And it does that at a time when we're in an addiction epidemic. And it puts them outside of the reach of these services so that the children will be left behind and they won't be helped.
I'd like to
Dave, I'm going to have to address that.
um,
Forgive me, Helen, but I think there's just some things that I think you mentioned what addiction doctors really think, and I am one of them, and I'm one at OHSU, and I'm a researcher, and I know a lot of the people who write policy in this country, and I would take issue with that is representative of how we feel. I think the American Board of Medicine and how they make these decisions around what doctors do is very separate from the addiction medicine community and the prevalent research of today. And again, compulsory, I have a deep respect for both your experience, your personal experience, James, and yours, Tony's, and I'm never going to say that those are wrong. It's just not. It's just your experience, and what we need evidence for is to look at the broader evidence of what happens when we study this on adults, on all of these different groups of people who experience addiction, and it doesn't work, and it can cause harm. And I think what we're saying is that the premise that you're coming out with, James, is that the addiction is deferred by the fear of punishment, and that's just not what we see from the literature. There are always anecdotes, but it's just not what we see. And so that I think that we have to go back to this model of not re-traumatizing people, not infantilizing people, and offering treatment, because the cognitive openness to access to treatment is required in order to actually make movement towards real recovery.
So I would like to hear
Thank you,
what happens, I'm sorry. I would like to hear what happens if a juvenile is found with less than whatever the 1.99 grams of meth. Jessica,
$100 ticket. You can pay $100 or get a health assessment.
right, I'd like to hear Jessica answer that.
Thank you. So currently, if a child is found with a small user amount of methamphetamine, they'd be shoved into the criminal justice system, and criminalizing children is wrong. We're also seeing that, it's parents that don't have the means to get their kids into treatment that are using the criminal justice system, and that is disproportionately affecting minority communities. This measure would make a big change to that, because what would happen is that if a kid gets police contact and they have a very small user amount of drugs on them, the officer would give them a ticket, and on the back of that ticket, it would have a hotline on it. They could call that hotline and immediately be connected to somebody who's in the recovery community. They can start talking to them about what their options are and give them a soft handoff into the health services instead of a bumpy ride through the court system. Additionally, they don't have to wait to have police contact under this model, which is beautiful. Like, the parents could call it the hotline themselves and say, I have a kid who's in trouble. My kid's in dealing with drug addiction and I don't know what to do about it. They could immediately connect with somebody that's active in the recovery community and can help get that family referred into services without ever criminalizing their child.
So, but there's no one who's then, that sounds like it's number one, either up to the officer to proactively call the hotline or for the child to share that information with their parents.
Correct.
That's right.
Well, what I can say is this right here.
So here's my question. How do you make sure, I think everyone would agree, you don't want to see a child be sent to jail. You don't want to see that.
Right.
But how do you make sure that they actually get them the services that they need?
The services that they need are offered to them in a harm reduction model. So here are the services. We can get you help. And when they're ready to engage with that harm reduction model, those things are there and available for them. Additionally, there would be more robust resources for treatment statewide. So even if they're not ready now, when they become ready, they'll have more services available to them.
Is there any research kind of looking at the effectiveness of a voluntary kind of situation like that for juveniles?
I think that Dr. Seaman would probably be best to talk about the research.
So I do manage mostly adults in medicine. I don't have a juvenile practice. I'm certainly happy to follow up with you on that research. I think in general, though, the evidence for chosen treatment is always better than the evidence for compulsory treatment. I don't know why that would be different with juveniles. It's certainly possible that it is, but I think the big picture is that increasing access, decreasing the re-traumatizing process of a continued engagement with the criminal justice system is very likely to be better. And, you know, the Portugal model would support that. I've talked with Dr. Gallo in the Portugal model. I've been to Portugal. He would strongly advocate for this program.
So here's my own.
I think this idea, we'll probably all agree there's not enough treatment capacity in the state of Oregon. All the facts show that. All the experience says that's true. We're way underfunded. So to maintain the model that says we have to coerce people into treatment and we cannot relent, we got to keep that pressure on to get into treatment that does not exist. And that is, you know, this is the model we've had for now 40 or 50 years. We're losing 24 people a day, including young people. This is the opportunity to create some actual capacity for people who want to change their lives to actually get some help. And it does not require compulsion. We don't have enough now to make even compulsion work. That's just producing pain for no objective reason. So this is a chance to change. I've been doing this for a lot of years. We got to admit that what we have been doing is not working.
And I just want to say so many educators and parents that we talk to don't want to criminalize their kids. They want to have resources available for the kids to get treatment and recovery. And that's why we've been endorsed by many educators, the Oregon School Social Work Association, the Oregon School Psychology Association. And while there hasn't been enough research done on treatment, you know, compulsory or coerced versus voluntary, the most comprehensive study has shown that on a whole, that there is no evidence that coercive treatment works more effectively and that policymakers should implement voluntary treatment because it's a much better harm reduction model and does less harm.
So I don't disagree
with a criminal record, man. That criminal record will follow those kids for the rest of their lives. What are you thinking, man?
The question is, what is the mechanism to get them to treatment? No one's talking about, you know, a jail intervention or anything like that. But the question is, how do you move from here's a ticket to, you know, this is a program, and, you know,
that's my worry. I agree with the charge that everyone has here, and we've been working towards building up a system that's super intentional and has interventions built all throughout it, including public health. And this measure, I agree with what it's trying to do and everything, but right now the facts are this: people like me, and I know a lot of people, I work in recovery every day, the criminal justice does provide that little intervention system for them, but I don't see where they adequately build a new one.
Here's the thing.
And in the interim, I'm worried about people who won't get into treatment. That's my issue. And I don't think we could have to take from education and prevention to get there. I think we could be more innovative and work together and bring in additional revenue to beef up the entire system. And I don't think $68 million is going to meet the need. And in the measure, there's no mandates for culturally specific services. There's no mandates for X amount of services to go to children. There's just isn't a bunch of intention in it. And that's where the problem I have. It's not that we need to do public health or criminal justice. It's how do we get there?
No, everybody receiving funds of the measure must be done in a culturally specific measure that's evidence-based. Now, Ed, you wanted to say something?
The best way to get anybody into treatment, including young people, is hearing it from another young person in recovery. That's the best way to get people into treatment. So when we have more capacity and we can actually have a funding source that will actually fund recovering mentors, and including younger ones who can then relate to people about what their issues are, will be much more successful in getting people into treatment. And probably, from my experience at 25 years, of having recovery mentors at Central City Concern. They're the most successful at getting people through treatment into a long-term recovery situation. So that's the capacity we need for these young people, not simply giving them an arrest record that makes it very difficult to get employment in the future, or housing, or education.
Children don't get arrest records. They're easily expunged. The second thing is, before you disrupt the successful juvenile court intervention and treatment program and the system of how children are moved into treatment in a very compassionate and easy way, you better have another system that's proven to work in Oregon, in place, that works at least as well, or you're going to kill children. The other thing I want to say is regarding an earlier point that was brought up. Of the 8,000 that are arrested, 4,000 are convicted. What happens to the other 4,000? They choose to go to treatment. They successfully complete treatment, and the courts dismiss their cases. So half the people went to treatment and avoided conviction. What about the people who got conviction? When the legislature reduced felonies to misdemeanor drug possession offenses, they realized that they were putting those felony people outside the range of formal probation where they get state-funded treatment. So the legislature said, okay, we're going to make them misdemeanors, but we're also going to provide that they can have supervised probation where they can get state-funded treatment. So everybody who gets a misdemeanor conviction gets state-funded treatment. They're going to be put on probation and required to. It's unfortunate that not all DAs in this state allow people to just do treatment and get a dismissal, but that's the way it is. The progress is that less and less of them do it all the time.
That's not accurate. The courts do not provide state-funded treatment for people on misdemeanor charges. What happens when somebody's convicted of a misdemeanor is that they get told they have to go pay $150 of their own money to get an assessment. If they never get the assessment, they never move past that. They just go to jail. So that's $150 out of pocket. They then get told by the evaluator that they have to go to a treatment program, and they're going to have to pay for that out of pocket. It's either going to be out of pocket or it's going to be covered by their health insurance. While there is some limited state funding for treatment, that's like inpatient beds that applies much more to people who are dealing with more serious crimes. Nobody that's getting arrested for PCS at the misdemeanor level is getting access to those state funded treatments. It is pretty much exclusively out of pocket by the individual. It's not treatment provided by the court. It's treatment that the person has to go and get on their own. So this would actually give them direct to healthcare as opposed to having to get wound up in the court system. And I think a big piece that's being missed here is that the courts are really slow to move. So you're not dealing with somebody that's in their crisis in the moment and getting them access to services quickly. You're talking 3 months, 6 months after they have police conduct before they actually ever get referred to a treatment program. Whereas the measure would allow that in the moment harm reduction contact that they could take advantage of right away.
Yeah, I think Jim's statement kind of sums it up for the difference between the opposition campaign and our campaign. We say we cannot afford to wait. To Jim, the system works great. He thinks people get their records expunged easily. When you talk to people like Bobby Bird and other people of color that have been disproportionately harmed by these harmful drug laws, getting your record expunged isn't that easy. And when you lose your financial aid, lose your housing, lose your educational opportunities, lose your ability to get a job, it's too problematic, and we're not funding treatment. We convict people, but then don't fund treatment. Under Measure 110, we no longer lay these harmful arrests and convictions on people, and then we fund treatment. And in the end, this is not a heavy lift for Oregonians. This measure polls well because Oregonians know that we are in an addiction and overdose crisis. They know it's nearly impossible, like Jessica said, to find treatment when you need it. They want treatment, and it's clear that the system has failed, and we need to move to a health-based approach. This isn't radical. This is a rational next step, and I think that's the fundamental difference between us and like Jim. Jim thinks the current system works fine, and we vehemently oppose, and we know the current system has failed, and it's time for a health-based approach.
I don't think
we do not say the current system is okay. Like, I think that's a misrepresentation of what we have done, and I think you know that.
Jim said it worked good. It was a success.
I said,
well, that's not what I think.
You should not replace what works now with something else. I didn't say it's perfect. I think it needs a lot of work. And as far as the expunction goes for adults, I'm part of a coalition of people who's already had a bill pre-filed to deal with that. Okay, so the legislature in Oregon can take care of Oregon's problems, but that doesn't take anything away from what I said earlier. You're not taking care of the kids.
And hey, you guys, I actually have to go get my kid. I hope that the media just will portray this as two entities fighting towards the same thing with a difference of opinion how to get there. I agree with mostly everything everyone says. I just don't think this measure gets us there. I don't think it gets us there. I don't think it's enough money. I think we need a central city concern, you know, Blackburn building in lots of counties, and they're expensive, and we need more money to get there. We need lots of investments in adolescent treatment, but this measure doesn't do the things that we need to get there.
If you need more funding, Measure 110 provides more funding.
We need explicit attention for tribal communities, which this campaign has not engaged in with tribal communities until at the very end when it was seeking endorsements. And that works to undermine the sovereignty of tribes, period.
Well, the current system isn't working for tribes, and this provides more funding and treatment for tribes and everybody.
I know.
Funding and treatment all across the state of Oregon.
Thank you all. Laura, did you have any questions? I know it's hard for us to get a word in edgewise, but.
No, I think I'm good, but thank you.
Okay, great. Thank you all for this. It was a really interesting conversation. It's an incredibly difficult issue. So I really appreciate the passion and the detail and the information perspective you've all brought. We will be discussing this and figuring out, hopefully in time for Wednesday, what our feelings are about this. And if we have any follow-ups, we'll contact you. So
thank you so much. I really appreciate your time.
Thank you.
Thank you.
Thank you for the conversation.